Welcome to the Concussion Fix podcast, where we lift the veil on concussion recovery and empower you with real answers to real questions about persistent concussion symptoms. Each episode, you'll hear real, live Q&A sessions with real members of the Concussion Fix program, an online recovery program that has helped more than 3,000 people find relief from their persistent concussion symptoms. Guided by our experienced clinical team, Dr. Paul Hrkal, Melinda Krynen Hill, and myself, Dr. Cameron Marshall, we're here to share insights, empathy, and a clear path forward. In order to protect the privacy of the members, we have stripped away names and blurred faces. Please remember all information shared is for educational purposes only and should not replace medical advice. If you need extra support and guidance for your recovery, we encourage you to check out the Concussion Fix program by visiting concussiondoc.io or Google Concussion Fix and read some reviews and see if it's right for you. Whether you're looking for answers, hope, or just a little bit of encouragement, we're here for you. You're not alone. Recovery is possible, and it starts right here.
All right, welcome to Q&A day. We can go to our first question.
So my question is for Dr. Cameron Marshall. Basically right now I've seen 3 different chiropractors, and I kind of messaged you about this in the news feed. Or actually I talked to you about this, how they were doing, like, I guess the old school method of chiropractor where you kind of just go for like 5 minutes every week and they just do adjustments or some light work, but nothing like deep tissue massaging or anything. Um, and I'm gonna try another guy today and see how he does it. But I don't know. Do you think I should just like keep trying people, or I'm also honestly just considering like just I mentioned this last time also, like just flying out and seeing you in Toronto if that's possible or not. I mean, I would I probably have to see you, like, once a week for it to work? I don't know, that's kinda my question.
Yeah, I mean, it depends on what the issue is,
Yeah.
and how, dysfunctional things are. Um,
It feels like my neck is, like, worse than it's been, and so I got my injury, like, 2.5 years ago now, and for the past month or 2, my shoulders are sore and my neck is super sore in the morning, and I think it's because I've been studying for an exam. I think that's my theory, like, I don't know, like, maybe having bad head position on a computer or something, but yeah, so
yeah, possibly. I mean, the reason I don't encourage people to like come and see me is because A, you'd have to spend a lot of time here, or you'd be like flying in, flying out, flying in, flying out for, you'd spend so much money on plane tickets back and forth, or you'd be stuck in a hotel or something for, let's call it 6 weeks. And
yeah.
then inevitably, if you have neck dysfunction, it's likely to return. Right? It's not something that,
Mhm.
like, you just fix it and it's gone forever. Usually what happens is you get it to a place where you're good for, like, let's call it 6 months, and then things will kinda tighten back up again, right? Like any injury, right? If you've dislocated your shoulder in the past, it's likely that you're gonna dislocate it and it's gonna give you problems for a long time, right? You can get treatment to reduce that, right? But it's generally gonna have some issues going forward. Same thing with knee issues, or, you tear your meniscus in your knee, it's going to constantly give you problems for forever. Same thing with neck. And so by you saying, okay, well, I'm going to be your guy. You're going to fly here, you're going to spend 6 weeks with me. You're going to go home, and a few months from now, it's going to tighten back up again. And your response can't be like, I'm going to fly to Toronto every time my neck gets a little bit tight. It's better to try and find the person in your area that you can rely on when things like that happen, so that you have it closer to home, you know what I mean? Um,
Yeah.
Now that being said, I've done this. Like, I had a girl come from Germany and stay here for like 4 months. She came, she stayed, she was in like she got an apartment here, like she was renting, she stayed, and then she's gone back to Germany. She's fully recovered and she hasn't really had any issues. So I mean that can happen too, but it's a big commitment to be away from home. Then how's your diet going to be when you're eating takeout every day? And I don't know. It's just not as clean. So my recommendation always is to really just keep kind of trying to find something closer to home. Now, have you gone the ART route? Like, have you gone to the ART website as your first line of defense, or you just going Cairo?
The first 3 people I saw were ART.
But they didn't do it?
No. Well, I mean, I don't know. They barely massaged, like, it didn't even hurt at all, and they did adjustments. So, I don't know if that's ART or not.
Yeah, I mean, ART is like a technique, right? So if they do like 3 passes, they could say they're doing ART, but like my treatments, for example, are about 45 minutes.
Is
Sometimes
that common, or is that something that I'm
no,
gonna just have to, like, keep looking at
it's
all of
not
them for?
it's not common. The reason I spend that much time is because I charge a lot more for it. Like
Okay,
the average chiro that's treating a whole bunch of different conditions, they're gonna charge their typical chiro rate. Let's call it $100 a session. Well, in order to make that financially viable, they have to see a lot of people, right? Whereas I'll charge $350 a session, but I'll spend time with people. You know what I mean? So it's just a different model because the only people I treat are concussion patients.
mhm.
So I just know that for these patients, I'm going to need more time. So I just block my schedule accordingly and charge accordingly, and I can spend that time. So I don't think it's common. Um, but that being said, I would still try to find somebody closer to home. Like even if it's like 20 minutes, like that's still going to be a lot better than like somebody who spends 5. Um,
But how do I make sure immediately that it's gonna work instead of having to wait, like, weeks and weeks and just seeing if they kinda do like, if they actually know what they're doing when it comes to head stuff?
it's not even head stuff you're after. You're after neck stuff, right?
Yeah,
That's the distinction. Don't worry about the head stuff. What you're looking at is somebody who's really proficient with necks that has a lot of experience in treating headache disorders.
okay,
Because the reason they're good at headaches is because they're good at necks. So it's like you got to go to their website, look at the conditions they treat, and if like headache is a big component of what they do, then they're probably pretty decent at treating, neck issues. Um how are you going to know whether or not you're in the right place in the first go? That's harder to say, but I think you can if you go to those manual therapy videos that I did, like does it kind of look like that?
uh-huh,
Give or take. It doesn't have to be exact, but like does it kind of look like that? If so, then okay, that's worth spending some time to try and see if it's going to be helpful or not. If it's like you go in and the guy, it's just like quick crack, 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 see you later, you could probably assume that's not going to be the right place for you.
mhm,
So that's maybe a way to do it is like if you go in and they actually like, okay, I'm going to work on this, I'm going to work on that, and then I'm going to, work on this a bit, and then okay, you know, and they're doing a lot of soft tissue stuff, then okay, now this seems different than what I've had before. I'm going to give this, 4 to 6 weeks to see where I'm at. Do you know what I mean? Where are you located, by the way? You're not actually that far. It's only about 4 hours to come see me if I'm
yeah,
driving. But by the time you go back and forth, you're going to be all messed up anyway.
yeah.
Um, I got a good guy in Windsor.
I think I saw that guy,
Jay
possibly. Um, I forget the guy's first name, well,
Chapieski.
is he actually, I think I saw a different guy then. I think I saw a guy named Andrew that was on the map for the
Was he
concussion.
Cairo?
Yeah,
Send me a direct message on the platform.
okay,
I got a guy who's like really good ART.
okay,
He's not affiliated with our concussion program, but that I don't think necessarily that's a big deal. You want somebody who's good with ART.
Yeah, Windsor would be great. That would be like an hour drive, but that's fine.
Yeah. So why don't I'll send you this guy's details.
Okay.
And I'll actually just even give him a call and say, kind of what you're dealing with and kind of like, what I would recommend just in terms of like how I treat this stuff. He'll know exactly what I'm talking about. And that might be a good try just because it's not as far as me. Uh, yeah, send me a message in the platform.
Okay, that sounds great. Thank you.
Okay. Okay, next up is
Yes, hello everyone. I think my question or my questions are for Dr. Hrkal as well, related to diet. And hearing about it feels maybe a little easy, or I don't know, but I will still ask it. So I just started with a bit of the diet in my first week that you proposed. And I have been lactose free and gluten free for a long time, so I think that will not be a big problem. But the first part of the question is about dairy. As I'm living in Switzerland, we do have great cheese, and I love cheese, and there's a lot of lactose free things. But what I haven't really understood in all the models is what is the impact on the dairy in regards to health of the brain or the inflammation. As I also tried a bit of Chinese medicine, a bit of Ayurveda, and everything has similar aspects, but they're all not the same. I'm wondering, is the yogurt now good or not, or the bit of cheese, or how do I deal with that?
Yeah, very good question. It's a really common one we get a lot. Have you worked through the 1.0 or the 2.0 course?
2.0.
Okay, so in the 2.0, I really went to great lengths to clarify the whole dairy versus gluten and things we're trying to avoid. Because in 1.0, there was a little bit of confusion because in some of the live sessions and even some of the modules I mentioned, if you are dairy sensitive, you should avoid dairy products. That is because dairy, along with gluten, and I would say along with eggs, those are the top 3 food sensitivities that the published literature talks about, as well as I see in my clinical practice. They happen to also be the 3 big staples for most people's breakfast, especially. And if you live in Switzerland, you're getting all 3 of those because you have some really great options that I think are quite tasty, obviously, and probably the best versions of those, right? So when it comes to dairy, it really comes down to, are you particularly sensitive to dairy protein? Because you've mentioned lactose a number of times. Lactose is a sugar that's found in dairy products that people can't break down. And I rarely refer to lactose because lactose is a very obvious sensitivity. That's something that's an obvious intolerance. That's something that if you eat any dairy products, you are having loose stools or bowel changes immediately right away and you're rushing to the bathroom. That's because you can't break down that sugar. What I'm referring to when I talk about sensitivities is that there is an inflammation reaction to protein found in a food product. Now, we only talk about avoiding gluten-containing products in the course, and I explain in the course because there's many things that you could be sensitive to, but gluten has the strongest connection to the neurological system, as well as, of course, the gut system and others. But the goal is not to make the Concussion Fix diet as restrictive as possible, because I want our members to be able to still eat a very well-balanced diet, and I don't want this to be a huge obstacle for them to start implementing some of the changes. So we selected gluten as being the major thing to avoid, along with processed sugar and alcohol. Now, dairy products is not on that list, and so it comes down to you if you are sensitive to dairy. Now, how do you know that? Well, one of them could be, you don't necessarily feel so well after you drink a glass of milk. Some people will find that they tolerate cheese and yogurt better than they tolerate a glass of milk or something like ice cream. And that's because there is slightly more amounts of certain types of protein, certain types of fat in those particular more liquid and richer types of dairy. So do you find any sort of reaction to dairy after you eat it?
Yes, and it's not always the same. So I've had probably problems with milk protein when I was a little baby because I couldn't tolerate cow's milk. Then it somehow grew out, and then it came back with about 16 years. And since then, I think it's definitely lactose intolerance, but then it sometimes depends. And I think it depends with stress levels, but then also sometimes I know, and sometimes it's just very hard to find. What I have diseases that go well, but now my doctor told me with the last blood test, my cholesterol is a little bit too high. And I'm like, oh, okay, maybe that has an impact also with the concussion. So is it now the good?
Yeah. So concussions don't have impact on your cholesterol levels. I've had that question before, so that's not something you need to worry about. But definitely on gut function, because as Melinda has mentioned already, the nervous system plays a huge role on how you digest food. So it comes down to, as you've already said, sometimes if you have high stress levels or your nervous system is dysregulated, you're going to have more sensitivity and reactivity to food, where when you're more relaxed, you're having less reaction. So I think sometimes what happens when people have identified lactose, because that's the most common thing, when people go to their doctor and say, you know what, I don't feel good after dairy, the first thing their doctor says is avoid lactose containing products. So then they switch over to lactose-free cheeses or lactose-free milk, and sometimes that eliminates symptoms totally, but sometimes they still get some symptoms, as you've pointed out, with some things that they eat. Maybe not all of them. Now, you may also have a sensitivity to the proteins found in dairy products, and that is independent of lactose. And that might explain why some things you react to and some things you don't. And that comes down to the amount of these proteins that are in it and how strong the inflammatory reaction is to it. So one way that you could figure this out is avoid all dairy products in every way as much as possible. And then you can do that for about 3 to 4 weeks. Whether or not it's lactose, it's irrelevant. You want to avoid all dairy products. And then you can reintroduce one type of dairy product after every 2 or 3 days. So I'm going to just start with one type of cheese. So after that 3 to 4 weeks, start with one type of cheese and see how you feel. Assuming when you avoid it all, you should have some sort of improvement, whether it's gut related or whether it might be energy or something like that. So that's one easy way to try this.
Mm-hmm. Nice. Okay, thanks a lot. So I think the second one about cholesterol is good for now. Thanks a lot. No, I have a question. Do you think it's correct that products with sheep or goat milk should be more easy to digest?
Generally speaking, yes. Yes, generally speaking, goat and sheep products are easier to digest, but during the elimination, I suggest you avoid them too, because there's what's called cross-reactivity. So any dairy product is going to have a greater chance of reacting, whether or not it's sheep or cows, if you are sensitive to dairy. In my experience, definitely sheep and goat are less reactive, but I would maybe include that as part of the introduction. Maybe start with that, start with just a pure sheep's cheese or goat cheese, and then progress to actual cow's milk. And then if you do notice any sort of symptoms in that reintroduction, you have to go back to eliminating all dairy products for 2 or 3 days, let the symptoms subside before moving on to the next type of dairy to really give yourself an accurate representation.
Okay, thank you very much.
You're welcome. Good question. Okay, let's move on to...
Hello, I have a question about exercise intolerance. So whenever I've done the Buffalo concussion treadmill test, and I've figured out that, my max heart rate on like a good day is like 115 beats per minute before I, get up to the 3 symptom threreshold, or 3 point like increase or whatever. But like it's on like bad days, like because my symptoms kind of they fluctuate between the days. But on bad days, like uh like it's like 100 beats per minute that I get up to that 3 symptom threshold. So I'm kind of trying to figure out, like, do I have to change it day by day? Because I was thinking that I would just exercise at the same rate for the 2 weeks and then bump it up.
Yeah. Now, typically with exercise, once you identify what your threshold is, that's kind of what your threshold is. And you should be able to exercise at 80% of that with no issue for the next 2 weeks. If it's fluctuating, if that heart rate threshold seems to be fluctuating, then you have to consider that it's not actually the heart rate that matters, it's the other variables. So for example, if sometimes we'll do a treadmill test and somebody's walking, right? Because when you're walking, you get bouncing, so there's a little bit of visual motion going on. Maybe there's some neck dysfunction, and somebody might get symptomatic at a heart rate of, let's say, a 115. But is that related to the actual heart rate, or is that because that amount of bouncing up and down is actually what starts to trigger their symptoms? And then if you're having a bad day, maybe your neck's a little tighter, maybe your eyes aren't working as well that day, and now it happens earlier in the process. Is that because your autonomic system has gone down and you're now have a new heart rate threshold, or is it because the type of exercise you're doing? So have you tried doing it, let's say, on a stationary bike where you're removing that visual motion piece?
No, I've only ever done it on the treadmill. But I guess I could try that. I'd have to get a gym membership. So yeah, I've never tried any other type of exercise. Other than just like, I mean, if I'm lifting up something, like, it'll spike my heart rate or, stuff like that.
Yeah, but that's also engaging your neck and shoulders and everything else, right?
Yeah.
So that's where it's really about isolating variables. So if you notice that it's inconsistent, I would start wondering if other variables are the reason for that. And then I would try a different exercise modality. Bike is an easy one because it kind of keeps you stationary, and removes kind of the visual motion piece from it. So I would recommend kind of trying more of a bike protocol to see if that heart rate really is the factor or if it's something else. And the way that we typically do the bike test, just for your knowledge, is that you need a bike that kind of measures RPM, right? Like your pedaling cadence, how fast you're pedaling. And then what you want to do is you want to find kind of a comfortable pedaling cadence. So you basically set the tension to 0, find a pace that works well. Usually it's around 60 to 70 RPM, right? So it's just kind of a nice pedal. And then what you do is you bump the tension up slightly and you monitor your heart rate. Once you bump the tension a little bit, your heart rate will start to climb, and then it'll kind of stabilize and plateau. And then once it kind of stabilizes and plateaus for, let's call it 30 seconds, then you bump the tension slightly again, and then your heart rate will go up, and then it'll plateau and stabilize. Once it stabilizes for about 30 seconds, bump it again. And you just keep doing that to kind of go in this stair-step fashion to try and figure out at what heart rate those symptoms increase by 3. Then that'll be your threshold. Then you take 80% of that, and then you exercise at that 80% level for 1 to 2, or I would say for your case, 2 weeks. And then you come back and you retest yourself. So again, start with 0 tension, 60 to 70, increase it slightly, you get that rise, and then plateau, and then just keep doing that until you get your 3-point threshold. That's your new threshold. Take 80% of that and do that for the next 2 weeks at that 80% threshold. You may want to try that just to kind of take those other variables out of the equation, because that might be what's driving this.
Okay. I also have a small question about just the like if I'm like, lifting stuff, and like there's like some days where like just walking up the stairs, it feels like I'm like going past my threshold. Is that like affecting? I know that like it usually, if you do go past your threshold, it only lasts for like a day or so. But like if I'm like passing my threshold every day, on those bad days where I can barely even walk up the stairs without, getting all of the symptoms, am I really actually even like recovering, I guess?
I wouldn't worry about those temporary things, right? Like you go up a flight of steps, it's like, yeah, your heart rate spikes up, but it's not like you're exercising at that level, right? Like I wouldn't worry about any of that stuff. What you want is like the steady state cardio at the sub-symptom threshold level, right? Because as you do that, your capacity for doing things like going up the stairs or lifting something heavy will actually increase over time as well, right? If you go up the stairs and your symptoms spike a bit, I wouldn't consider that to be like, oh no, I'm setting myself back. That's not the case. If you were to exercise at that heart rate for 20 minutes, yeah, you're banging your autonomic system into a wall. But like these little temporary things like, oh, I have to go up a flight of steps, my heart rate's going to go probably above my threshold, but it's so temporary that like, okay, whatever. I wouldn't even worry about that in the slightest. You just don't want to sustain exercise at that level.
Okay.
Does that make sense?
Yeah.
Yeah.
Thank you.
And then as you get on a good routine of doing this and sticking with that 80% level and then retesting every 2 weeks, and that increases, your capacity for doing those other things is going to go way up. So climbing stairs won't be symptomatic provoking anymore because that'll actually even be below your threshold.
Oh, okay, cool.
Right? So it's just getting on that routine. And I think that there could be other variables at play just given the fluctuations that you're experiencing.
Mm-hmm.
But also it's like you also have to consider like how much is your anxiety level playing into this, right? Like have we done enough work with Melinda's section to have the tools in place so that if things do spike, I can calm it down. So there's other things to consider there.
Yeah, I've kind of thought that it could be definitely related to that as well. Like I've noticed that the same symptoms they spike whenever I, like like whenever I'm watching a movie. I've heard that like, screens can kind of, stimulate your sympathetic state or whatever. So and it's like the same symptoms as whenever I'm exercising or similar symptoms. So, yeah.
Yeah, and it could be that, anxiety response. Like screens in and of themselves can kind of be stimulating just because they do kind of flicker at you and they can be bright and stuff like that. But then it's what's my response to this? If I have this idea or belief that screens are bad and now I'm here sitting watching a movie, what's that now going to do to is that going to make it worse because my kind of autonomic response or my anxiety response in relation to that? Right? So we have to be able to kind of separate those two. Right. So it could be something like that.
So are screens kind of the same way in terms of exercise where you kind of slowly build your tolerance to it or?
Yep. Yep.
Okay.
So what you're looking for more so is like time, right? So if I'm going to sit down and do computer work, I want to kind of set a timer and I want to figure out how much time I spend on a screen before I kind of have that 3-point increase. Okay, I can go for an hour before I hit that symptom increase. Okay, that's my threshold. So now I want to take 80% of that. So from an hour, maybe I drop down to, 45 to 50 minutes, right? That's 75 to 80% of an hour. So now I know I can stay in there because it's below when my symptoms increase. So I'll do that. 45 minutes is going to be my cutoff point for the next 2 weeks. Then I'm going to sit down again after 2 weeks, set a timer and be like, let's see how long I can go. Now maybe I can get to an hour and a half. Okay, great. Now I'm going to set my timer for the next 2 weeks at an hour and 15 minutes. So I'm below my threshold. Then after 2 weeks, I'm going to set my timer and sit there and see how long I can go. Now I can get to 2 hours. Okay, now I'm going to sit down for an hour and 40 minutes when I do it. You know what I mean? So it's this gradual, it's like you challenge it, figure out what your threshold is, and then drop it slightly, stay there for a few weeks, and then re-challenge it again. Find out what your new threshold is, drop it slightly, stay there for 2 weeks, challenge it again. And you're constantly kind of stair-stepping up in this gradual reintroduction.
All right. Thank you.
You're welcome. Is next?
Yes. Good afternoon again. I have a follow-up question from last week. I asked questions about dizziness, vision, and neck. And I didn't really understand how, when you have difficulty with patterns, when you see patterns or when you see the leaves in the forest, how is that related to neck issues? And the same with the accommodation problems with the eyes. What is the relation with the neck, or how does it work? Because I cannot explain it to other people because I don't really understand.
No one really understands it. So I can't really give you like an explanation of like it's this particular pathway in the neck. But what I do know is that it can be involvement from all three systems. It can be a visual problem, right? It's kind of like this thing called an optokinetic reflex, where it's like any type of like moving patterns, or even just, it could be just visual motion sensitivity, right? Because your eyes are picking up all sorts of different stimulation when you're walking through kind of a patterned area. So it can be neck related because your eyes and your neck communicate. So there's kind of feedback loops from that. So if your neck is dysfunctional, your eyes can become dysfunctional, even in the way they move together and they pick up different things. So by fixing the neck, sometimes you can alleviate some of those visual problems. But the problems you're experiencing could also be visual. So you have to kind of look at it as like a triangle. And it's just working on all three components of that triangle to try and kind of narrow in on it. It's impossible to tell which one is visual, which one is neck, which one is vestibular, right off the bat, right? So even like our vision therapist, for example, she'll pick up all sorts of eye issues. But what she'll also say is, I want you to start getting your neck treated while I work on this stuff. Because I don't know if the eye issues you have are actually purely visual or if there's some that are coming from the neck. And so we work on both together. So that's all. Like, that's really all we need to understand, is that your neck influences visual function influences neck function, and vestibular is in the middle there too. So all three of those systems have to be giving you congruent information. If one of those systems is giving you different information than the other two systems, then you feel out of whack and off balance and dizzy. So you just have to figure out which part of that triangle is the dysfunction. And it could be two parts of the triangle that are dysfunctional. So that's why working on all three is kind of the best bet when you get to this rehab section. I always say that if you had to pick one and you could only like afford one, then I would always start with neck. Tends to be the cheapest, and the visual system and vestibular system can't work as well if the neck isn't working as well either. So I tend to start with neck. If neck reduces the symptoms and eliminates them, great. You don't have to do anything else. If you do a lot of neck work and you're still having the issues, now you have to add in the other two pieces.
Okay. Yeah, we did start with the neck, but I stopped with the neck now because of all the dizziness. But if I...
So the neck treatment was making you more dizzy?
Yeah, we first we did the neck, and then proprioception, and then rehab, and then we went to the eye exercises, and then things went wrong.
So I would continue with the neck as you do the eye exercises. Because what happens is, if there's neck dysfunction there and you've kind of cleaned it up, let's say, but then you start doing vision exercises, it'll make the neck dysfunctional again if you're not continuing to focus on it.
Okay, so we should do both.
Yes.
Yeah, I'm a bit cautious now because it went so wrong 2 weeks ago. So, but I should go back with the neck and back on the eye exercise.
So think about it. Like, let's say you have some neck dysfunction and we treat that, and now you're starting to feel a little bit better, but there's still some lingering issues. Those lingering issues might still be some ongoing neck dysfunction, but as soon as you start doing eye exercises, that's going to challenge your neck. Remember, every time your eyes move, it's engaging your neck.
Mm-hmm. Yeah, okay.
And so if that happens, now that is going to get tighter, let's say, and now start to cause all those types of same symptoms. You're thinking, oh, it's the eye exercises that are doing it, but it might be the eye exercises engaging the neck. And if we're not working on continuing to keep that neck nice and loose, then you start to get all those symptoms coming back. So that's why you want to do them. So you do vision exercises, you start getting some dizziness and stuff, and then you treat the neck. And now it reduces. So it allows you to continue doing the vision rehab, but keeping the symptoms at bay because you're addressing the neck at the same time.
Yep. Okay. That's a good answer. I get that. Thank you.
You're welcome. Next up is
I just have a quick question on nutrients and tinnitus. I just recently watched the Key Nutrients for Brain Recovery seminar from Dr. Hrkal, in which you mentioned that according to which type of tinnitus you have, you mentioned 2 different ones. There are some different things you can take, supplements. And I just wondered, how can I know which kind of tinnitus I have?
Okay, so the healthcare provider that you're working with can give you some insight on what type of tinnitus. Also the symptoms you have. So like one of them is what's called pulsatile tinnitus, which has to do with blood flow. So when you feel it, does it kind of come like a whoosh sensation?
Sometimes I have this kind of sensation that like sometimes it feels like I can hear my pulse in the ear, but it's also like a mix of a very high pitched tone and then the sound like a buzzing noise, like sitting in an airplane.
Okay.
Yeah.
Because some of the main reasons why tinnitus happens is it's a neurological issue or it's a blood flow issue. Obviously, the two of them are connected. But those are the 2 things I was talking about in that particular presentation that you're referring to. And if it's a blood flow, then we can look at things like, for example, things that are going to regulate blood flow. So ginkgo biloba is probably one of the ones that are most well known for improving blood flow to the brain. But when it comes to neurogenic type of tinnitus, then we're looking at other kind of like more typical nerve supportive botanicals or nutrients. So obviously omega-3s I think would be beneficial for both of them because they address both. Those are the high DHA, so that section I think applies. There was a substance called palmityl ethylolamide or PEA, which has the effect on the nerve function, especially neuropathic conditions, so that can be helpful. There's a number of other pieces of research on antioxidants like pycnogenol. Again, I know this is above the scope of the course, but I think I mentioned some of these in that particular presentation. So I would go back, re-listen to it if you can, pick up the exact things I was talking about, and then hopefully you can determine, do you have that more blood flow pulsatile tinnitus? It will sound almost like a pulse or a wave. Or if it kind of comes and goes and it's like that high-pitched buzzing sound without kind of any sort of fluctuation, that's more neurogenic.
Okay, great. Thank you.
You're welcome. Okay, I think that's it. Nikki, we'll turn it back over to you.
Yes, great questions today. A lot of really, really great ones. Great comments in the chat as well. I hope everyone has a fantastic day. We are already at 11:15, so we'll kind of end it there. And have a great day, everyone. Bye.
Goodbye.
Thank you for tuning in to the Concussion Fix podcast. We hope you found today's episode helpful and that it gave you a little more clarity, hope, and confidence on your road to recovery. Remember, every step you take matters, no matter how small it may seem. If you feel that you could use a little more support on your healing journey, check out the Concussion Fix program. Just visit concussiondoc.io or simply type Concussion Fix into Google and read some of the reviews from people who've already walked this path. With over 3,000 success stories and an average symptom reduction of nearly 50% in just the first few weeks, it might just be the help you need to break through. Thank you again for listening. If you found value in this episode, please share it with someone you think could benefit, and don't forget to subscribe so you never miss a session. Until next time, stay hopeful, stay curious, and continuously remind yourself that recovery is possible.